Dr. Ricardo Martins, a 55-year-old physician, is well known for his dedication to medicine and his patients. Born in a small town in the countryside, Ricardo always dreamed of becoming a doctor to help those most in need, inspired by the lack of adequate medical services in his community. Ricardo graduated with honors in medicine from the University of São Paulo, one of the country's most prestigious institutions. He completed his residency at the renowned Hospital das Clínicas, specializing in general practice and family medicine. In addition, Ricardo has pursued several specializations in palliative care and humanitarian medicine through courses and workshops worldwide. After completing his training, Ricardo spent several years working in public hospitals, where he stood out for his work ethic, compassion, and exceptional clinical skills. He was often found working overtime to ensure all patients received the necessary care. Eventually, Ricardo was invited to join Hospital Santa Clara, one of the capital's most prestigious private hospitals. Over his 20 years at Santa Clara, Ricardo built an impeccable reputation. His colleagues admired him for his holistic approach to patient care, and he was frequently sought out for complex cases due to his extensive experience and knowledge. At Hospital Santa Clara, Ricardo was seen not only as an excellent doctor but also as a mentor and leader. He always took time to teach resident doctors and interns, sharing his experience and emphasizing the importance of treating each patient with dignity and respect. Throughout his career, Ricardo received numerous awards and recognitions. He was named Physician of the Year by the Brazilian Medical Association multiple times and received the Excellence in Palliative Care Award from the World Health Organization. Additionally, he authored several scientific articles and was a frequent speaker at international medical conferences. Ricardo is deeply committed to medical ethics. He firmly believes that everyone has the right to quality medical care, regardless of their financial situation. This conviction often put him at odds with hospital administrative policies aimed at maximizing profits. Outside of work, Ricardo is a dedicated family man, married for 30 years to Anna, a teacher, and father to 2 adult children who pursued careers in healthcare. He is also active in several philanthropic organizations, dedicating time and resources to improving access to healthcare in underserved communities. One afternoon, after finishing his regular consultations at Hospital Santa Clara, Dr. Ricardo Martins decided to walk to the parking lot to get his car. Along the way, he noticed a crowd of people near the hospital entrance. Curious and concerned, he approached and saw an elderly man lying on the sidewalk, clearly in a state of emergency. The man, about 75 years old, was pale, sweating, and struggling to breathe. His moans of pain were heart-wrenching to those passing by. The elderly man, later identified as Mr. Jose, lived in extremely precarious conditions. Wearing torn and dirty clothes, he appeared malnourished and dehydrated. His skin, marked by spots and wounds, indicated a lack of medical care for a long time. A constant deep cough suggested serious respiratory problems, and his weak pulse hinted at possible heart failure. Next to Mr. Jose, a plastic bag contained a few personal belongings, an old wallet, crumpled documents, and an empty medicine bottle. Without hesitation, Dr. Ricardo knelt beside the elderly man, quickly assessing his condition. He knew that the hospital where he worked had strict policies regarding free treatment, especially for non-patients who appeared outside of operating hours. The administration was clear. Any violation of these rules could result in serious consequences, including dismissal. However, for Dr. Ricardo, medical ethics and the duty to save lives came first. He immediately called for help, asking a passing nurse to bring a stretcher and a first aid kit. While waiting, he asked Mr. Jose questions, trying to calm him down and understand more about his health condition. Between difficult breaths, the elderly man explained that he had been evicted from his home a few months ago and had been living on the streets since then, without access to medical care or adequate food. Once the stretcher arrived, Dr. Ricardo and the nurse brought Mr. Jose inside the hospital, ignoring curious and, in some cases, disapproving looks from colleagues. The doctor knew that his act of compassion could come at a high cost, but there was no other option in his mind. He headed to the emergency room, where he began a comprehensive assessment of the elderly man. The emergency team, led by Dr. Ricardo, began to stabilize Mr. Jose. Blood tests, an electrocardiogram, and a chest X-ray confirmed severe pneumonia and cardiac decompensation. Dr. Ricardo immediately ordered the administration of intravenous antibiotics, fluids, and medications to stabilize the elderly man's heart condition. Though aware of the potential repercussions, he felt a sense of relief seeing Mr. Jose receiving the necessary care. Dr. Ricardo Martins, accompanied by an experienced nurse, promptly began the assessment of Mr. Jose upon his arrival in the emergency room. The elderly man was carefully placed on a hospital bed, and the doctor initiated a thorough physical examination. Ricardo checked vital signs, blood pressure, heart rate, respiratory rate, and temperature. He observed the pallor of the skin, bluish lips, and difficulty breathing, indicating hypoxemia. For a more in-depth assessment, Ricardo requested a series of tests: blood tests, complete blood count, electrolytes, renal and hepatic function, infection markers, PCR, and arterial blood gases to assess blood oxygenation, electrocardiogram, ECG to check the heart's electrical activity and identify possible abnormalities, chest X-ray to confirm pneumonia suspicion and assess lung status. Based on the initial results, Dr. Ricardo started treatment. Oxygen therapy placed an oxygen mask on Mr. Jose to improve oxygen saturation. Intravenous antibiotics administered a combination of broad-spectrum antibiotics to fight lung infection. Diuretics to relieve fluid overload in the lungs, common in cases of congestive heart failure. Fluid therapy, careful administration of intravenous fluids to correct dehydration without overloading the heart. During the next few hours, Ricardo closely monitored Mr. Jose's response to treatment. He adjusted medications as needed, regularly checking vital signs and the patient's clinical progress. The nursing team was instructed to perform frequent position changes to prevent pressure ulcers and provide adequate nutrition via a nasogastric tube due to the elderly man's extreme weakness. As treatment progressed, Mr. Jose began to show signs of improvement. His breathing became less labored, his skin color improved, and he could speak with less effort. Ricardo continued to encourage him, offering words of comfort and ensuring him that he was in good hands. With teary eyes, Mr. Jose held Dr. Ricardo's hand. In a weak but emotional voice, he expressed his gratitude. "Doctor, I don't even know how to thank you. I thought I was going to die there on the street. You saved me." Ricardo replied with a warm smile. "I'm just doing my job, Mr. Jose. Everyone deserves to be cared for." News of the free treatment quickly spread throughout the hospital. Some of Ricardo's colleagues were inspired by his compassion and courage. "This reminds me why I got into nursing. We need more people like Dr. Ricardo." However, others were concerned about potential consequences. This could get us in trouble with the administration. Rules are there for a reason. Patients who witnessed the act of kindness praised Ricardo's altruism. "It's rare to see a doctor who cares so much. He's truly an angel." The hospital administration soon became aware of the incident. While initially skeptical, some members began to reconsider the strictness of the policies when they saw the positive response from the hospital community and the praise Ricardo was receiving. Others, however, remained firm in the need to uphold the rules, fearing precedents that could complicate the hospital's financial management. Aware of the possible repercussions, Dr. Ricardo continued to provide the best possible care to Mr. Jose, believing he had done the right thing. His dedication and compassion did not go unnoticed, sparking discussions and potential policy changes within the hospital. The day after Mr. Jose's treatment, the administration of Hospital Santa Clara was notified about the incident. One of the administrators, Dr. Almeida, received a detailed report from a colleague who witnessed the event. The information quickly escalated up the administrative hierarchy, causing concern and outrage among the hospital leaders who were strict about policies regarding free treatment. The administrators reviewed the report and hospital records, confirming that Dr. Ricardo Martins had used hospital resources to treat a patient without insurance and without any guaranteed form of payment. They also considered the financial impact and the precedent this could set, fearing that other doctors might follow suit and jeopardize the institution's financial stability. Dr. Ricardo was summoned to an urgent meeting with the hospital's management the following morning. Upon entering the conference room, he found a tense atmosphere. The table was occupied by several members of the administration, including the hospital CEO, Dr. Enrique Soares, and the head of the finance department, Mr. Gustavo Braga. Dr. Enrique Soares began the meeting with a stern expression. "Dr. Ricardo, we are aware of the treatment you provided to Mr. Jose yesterday. We need to discuss your violation of hospital policies." Mr. Gustavo Braga continued, emphasizing the potential consequences. "You understand that using hospital resources without ensuring payment goes against our policies? This kind of action could put our business model at risk." Ricardo remained calm and explained his perspective. "I understand the rules, but as doctors, we have an ethical and humanitarian duty. Mr. Jose was in critical condition and needed immediate care. Leaving him without treatment would have been medical negligence." He continued, citing ethical principles. "Our Hippocratic Oath commits us to treat all patients with the same dedication and compassion, regardless of their financial situation. As doctors, our first responsibility is to the life and health of our patients." Dr. Enrique Soares responded with a controlled but firm tone. "Ricardo, we understand your position, but policies exist to ensure the hospital's sustainability. If every doctor starts making exceptions, we could face serious financial difficulties." The discussion intensified, with Ricardo presenting previous cases where lack of immediate treatment resulted in avoidable tragedies. "How many lives should we risk because of financial rules? We need to find a balance between our ethical obligations and institutional policies." Mr. Gustavo Braga argued that financial sustainability was essential to maintain quality care for all patients. "Without resources, we cannot operate the hospital, pay our staff, or maintain our equipment. Every decision has a cascade effect." Ricardo suggested a review of policies to include an emergency fund for critical cases of patients unable to pay. "We could establish a charity fund, funded by donations and fundraising events, to ensure we never have to deny care to those who truly need it." The proposal elicited mixed reactions. Some administrators showed interest in the idea, seeing it as a potential solution to balance ethics and finances. Others remained skeptical, concerned about the feasibility and management of such a fund. The meeting ended without a clear resolution. Dr. Enrique Soares concluded the session, stating that the administration would need to discuss further before making a final decision. "Ricardo, we appreciate your dedication and passion, but we need to carefully consider all aspects. We will deliberate on your proposal and actions." Dr. Ricardo left the meeting knowing his career was in a delicate position, but also feeling strengthened by having stood up for his principles. The administration, on the other hand, was divided between maintaining the rigidity of the rules and finding a way to incorporate a more flexible humanitarian component. After Dr. Ricardo Martins was dismissed from Hospital Santa Clara, his story became a significant milestone not just within the institution but across the medical and public community at large. The media and social media reaction was intense, sparking debates on medical ethics and hospital management. Colleagues, patients, and advocates for humanitarian causes rallied behind Ricardo, organizing petitions, protests, and sending letters of support. The hospital faced public pressure and a national discourse on emergency care policies and the balance between patient care and financial sustainability. Despite his dismissal, Ricardo's case prompted broader reflection on medical ethics and the need for more humane healthcare policies. Ricardo envisioned a clinic where all patients, regardless of financial status, could receive high-quality medical care. He planned to incorporate health education programs, disease prevention initiatives, and emotional support, creating an environment that not only treated illnesses but also promoted holistic well-being for patients and their families. With support from enthusiastic colleagues and potential funders, Ricardo began drafting a detailed plan for the clinic. He sought guidance from healthcare management experts and philanthropic organizations to ensure the project's long-term viability and sustainability. The local community showed significant interest, offering resources and volunteering to support the initiative.